r/askReddit. Serious doctors of Reddit. What is your how the hell are you alive right now story? I remember when I was an intern in the emergency department. Interns here have to do rotations in various departments. When a 30-something-year-old guy came in with simple earthy symptoms. Essentially coughs and the flu. However, the paramedics at Tridge found that his SpO2, the oxygen concentration in his blood, was low and there were some crepitations in his left lung. Pretty standard. Early stage pneumonia. I didn't like the sound of his crepitations. However, it was way too loud and far in between, and I don't hear any normal breath sounds. The patient was very comfortable. Otherwise. So, off he went to do some x-ray. I got my answer and the shock of my life when he came back. His left chest cavity was filled with bowels. The crepitations that I heard were bowel sounds. Simply put, the guy had no left lung. Judging from his comfort level and his own shock, we suspected it was congenital. We diagnosed him with a simple ERT and sent him home after routine observation. Bonus story. A couple of months after that, there was a middle-aged, probably 50-year-old lady who fell and has a laceration wound over her forehead. We patched her up and sent her to the X-ray to see if there's any fracture. What we saw was that she had scores, maybe hundreds of tiny needles embedded inside her skin. My boss told me that it's Susak. Now, Susak is a traditional cosmetic surgery procedure that has been practiced by my people for hundreds of years. The myth was, if a magic man bury gold needles inside your face, you can look young, charm people, hell, even gain magical powers. I guess one part of that was true. The middle-aged looking lady was actually pushing 90. Bowels as an intestine? Yes. He didn't have half his diaphragm and a lung, so his intestines filled the emptiness. 3 AM on a Saturday. I was working in the emergency room of a level 1 trauma center, and we had 3 people coming in after a gun battle. We only had 2 beds designated for severe trauma. So there was the typical discussion re which 2 people to try to stabilize, and which person to delegate to the makeshift trauma bay. Do we focus on the most severely injured, or the 2 most likely to survive? After what seemed to be a nearly comically drawn out and shakingly quiet / still wait, the first 2 victims arrived, and the stillness flipped to chaos. The first person wheeled in just didn't seem to have a head. There was this bloody mass at the top of his neck, but it didn't look human. I remember being so confused that we were using one of the bays for this person / body, who just could not still be alive. I was looking him over, and I noticed his left thumb was calmly and repeatedly cracking the knuckles on his left hand. It would squeeze one finger and rhythmically work down the other 4 and start over. He didn't have any anatomy left that we could easily intubate, and yet he was cracking his knuckles. I still can't make sense of it. He didn't stay alive much longer. Maybe a couple of hours. But that knuckle cracking seemed like such a human thing to do for someone that had no reason to still be alive. That's amazing and creepy. Could it have been some kind of automatic muscle memory thing? There was a criminal case in which a guy took an axe to his parents' head. Just enough brain remained where the dad got up, got the paper, and attempted to make coffee, despite being almost headless and bleeding to death. There was a blood trail left behind his daily habitual routine. Quick version since I'm on mobile and working right now. When I was a resident we had a guy who set the bar for achieving cockroach status, that is, just can't kill them. He came into the ED complaining that his dialysis catheter was bothering him. He had been picking at it to the point it was crumbling. He had only a small local abscess there. The kicker was that he hadn't gone to dialysis in over a year. Typically people who are dialysis dependent, as this guy had been, die 14 days after stopping dialysis. So did his kidneys suddenly start working again when he went off dialysis? It was San Francisco, 1986. An unfamiliar doctor in strange clothes passed him in the hallway and gave him pills, muttering something about dialysis. What is this? The Dark Ages? Copy paste from myself. Story time first. Some backstory. In Brazil, you can do internship way earlier than in most of America and Europe med schools. So keep that in mind. I was in my 4th year of med school and in the first day as an intern in a trauma hospital. After training, there was a bus crash right before, so all the staff was occupied when a woman came in screaming, "I am going to die. I got shot in the head." When I look up I see a really thin woman. Deep eyes, white as snow skin, with a bullet hole in the center of her forehead. She told us she owed money to a drug dealer and he put a gun against his head, shot and ran. Now, I believe because she has burn marks and gunpowder right there in her skin, and a hole. Now remind that I'm a student. And there was no available doctors in the moment. So I run to my professor that was with another patient and tell her story, and also that she is lucid, with normal life signs, and get her order to do a cord scan. The cord shows that the bullet entered the forehead trough, the first layer of the frontal bone, but not the second, and headed down trough palatus. Traught and stopped at a vertebra, C5 if I recall correctly. No brain damage at all. So we intern her, and a tracheostomy is put in place, along with emergency reconstructive surgery, only a first, not definitive approach, along with a cervical collar. After she is stable, 3 hours later in her room, 3rd floor, we go down to see other patients. The emergency then gets a call. "Hello. We are from the X hospital, 20 kilometers away from ours, and we found a patient of yours in our emergency." Then the nurses on the floor realized she was missing. She jumped a 3rd storage floor, broke her ankle, and got in buses until the other hospitals. Why? I saw him in here. He came to finish the job. And before you ask, yes, some people lost their jobs. TLDR, shot in the head patient could walk, talk, scream. That is one hell of a will to live. And one hitty drug dealer. You can't kill a junkie who owes you money by shooting her point blank in the head, and then manage to lose her when she's in a hospital bed. You deserve getting killed by a better drug dealer who will take your corner/favela level. I work at a trauma center as an anesthesiologist, so I see a lot of crazy hit. People surviving stabbings, gunshot wounds to the head, a freeway collapsing on someone during construction. But one case will forever stick in my mind. I got called down to the ER to help manage an airway. The call said there was a woman who had a difficult airway due to trauma, and there was a splintered piece of wood in the way. I walk down, ask what the story is. Little old lady lost control of her car, ran off the road into the side of a house. She ran into a wooden porch that was positioned almost exactly at the level of her nose. So I approached the lady to see what we are working with for an airway, and she legit has a chunk of wood that has smashed her nose, is sitting right between her eyes. Thing must have been 3 inches wide, God knows how long, and about 1 inch from top to bottom. About 4 inches of borders sticking out of her face. My immediate instinct is to say holy hit. Fortunately I didn't, because it turned out the woman was conscious at that moment. I intubated her. She went off to the scanner, and then to the OR. Last I heard, after a series of reconstructive surgeries she was doing pretty well. I occasionally think back to that moment and just wonder how the hell that woman was alive. Sinus crumple zone. Good damn it. Had a patient 25/M come in for a suicide attempt. He put a 20 gauge shotgun under his chin and pulled the trigger. He must have flinched because he blew the entire front part of his face off: jaw, tongue, teeth, nose, both eyes, partial frontal skull. Brain was completely intact, and he was fully alert and oriented. He was emergently cricoid thoracotomy and had to be transported face down on the gurney due to all the bleeding and to save his airway. Vital signs were stable after a hit ton of blood products, and he was transported to a specialist plastic surgeon for a new face a couple days later. It was creepy walking into his room and just seeing someone in bed with clear dressing over their head with no face and fully competent. Unforgettable nightmarish stuff right there. Also had a 72/M using a circular saw on a ladder cutting a 2x4 above his head. He slipped and the circular saw went right into his face diagonally from his right cheekbone through his right eye to the left part of his forehead. He was able to turn off the saw, detach the blade from the saw so just the blade was in his face, call his wife that he had an accident, and then drove to the Duckine hospital with the circular saw blade sticking out of his face. I wish I could have seen people's reactions when he walked through the ED doors. He lost his right eye and was in surgery for over 7 hours to repair his sinuses and face. I forget the number of stitches he had, but it was a retarded number, like over 500 or something. That dude was a badass but also an idiot. Calmly walks up to counter. I'd like to schedule an appointment please. Okay, and what will we be seeing UF? Holy hit. Could you schedule that appointment for right now? Or excuse me ma'am, would you happen to have a band-aid? I accidentally cut myself. We have a young man who we see frequently in our ED/hospital. He's quite ill chronically, including an impaired immune system, end-stage renal disease on dialysis, hypertension, etc. with underlying psychiatric issues to boot. Well, not long ago he picked at his AV fistula while in a room near our and it opened up, basically painting the walls with his entire blood volume. His heart stopped. He was resuscitated with blood and his wound was closed, and he somehow lived unaffected. He still presents frequently on the brink of death, painting the walls with his entire blood volume. You just made my morning a little better. Edit. It's just the way that you/tough said it that's funny. I'm sure it was extremely unpleasant for the part and everyone else involved. Which is not funny. You have an interesting way of attaining joy. Guy came in about 10 minutes away from death. He had been run over by a car. By the time we prepped him, he had passed. But per the doctor's moral code, we tried to save him anyway. After hours of constant work, we gave up. We declared him dead and were packing up when he woke up, like some horror movie type stuff. He just sat up straight and inhaled loudly. My assistant and I just looked at each other. It's been a couple of months, and he's still in NICU. But this memory will always give me goosebumps. Oh no, throw a blanket over him before he sits up. And this is my literal recurring nightmare. Thank goodness it's so early in the day. I wouldn't be able to sleep. It's 11 PM where I'm at now. Looks like I'll just sleep when the sun rises. All my patients who smoke and come in for COPD exacerbation all the time. If you look at a cord scan of their lungs, there is barely even any lung tissue. It is amazing they can breathe at all. Dang. My mother never smoked in her entire life and now has COPD. Her left lung is almost non-functional. She is in her late 50s and it really worries me. Go check yourself for alpha-1 antitrypsin deficiency. It's a protein deficiency which results in less protection against inflammation in the lungs. Don't smoke. Take this with a huge grain of salt. I'm just a stranger on the internet. Edit. Name of protein. Thanks to /u/the kitten's mittens. I got called down to the emergency department around 2 AM to admit a patient to the ICU. The patient had been found in a car in a parking lot, unconscious and obviously having trouble breathing. The guy had a huge mass in his right neck, around the size of a Giappa fruit. His oxygen level was frighteningly low. So the ED docs tried to intubate him. They couldn't pass the tube due to the mass making his airway around the size of a drinking straw. After repeated attempts, they called in the surgeons on call, which consisted of a chief surgical resident and a surgical intern. Those two attempted a bedside crike, but also failed due to the neck mass. Finally, after calling in other ED docs, they managed to pass a small tube and hook the guy up to a ventilator. When I arrive, he's laying on the bed completely unresponsive. He has an ugly, gaping, but relatively shallow wound in his throat, packed with gauze from the failed crike. He has no reflexes at all. His pupils are fixed and dilated. He isn't breathing on his own, relying entirely on the ventilator. The only thing he has is a pulse. The guy's dead. His heart just doesn't know it yet. We see this all the time. The patient will hold on for a little while until someone, i.e. family, decides to pull the breathing tube, at which point they'll die. So we get him upstairs to the ICU, and I go back to sleep. I wake up a couple hours later and hand my patients, including the guy, off to the day team. Later that afternoon I wake up again and check up on him. Turns out he woke up around noon. He pulled out his breathing tube on his own. After coughing for a minute or two, he proceeded to loudly cuss out every person within 50 feet, asking why they didn't let him die. Turns out he's had this neck cancer for a while. and just wants to let it kill him without doing anything about it. He just wanted to peacefully suffocate and be left alone. He got out of bed, signed his AMA paper, and left the hospital. Never saw him again. So he fainted in a parking lot and you guys kidnapped him and slit his throat. Course he's mad. Basically, can't we just die on our own anymore? Plus don't forget the insane medical bill they are going to charge him with. Lol. I have several. One patient comes in and has been feeling some chest pain for a while. Decided to do his own stress test at the gym and couldn't last longer than a minute on the treadmill, which earned him some snarky comment from his treadmill neighbor. Turns out his left main coronary artery, aka the Widowmaker, was 99% occluded. This guy could have been dead before he hit the ground if that has gone out. Then there are always those people who smoke, drink, have had cancer, heat disease, lung disease, you name it, but they somehow keep fighting. Then the people who you are amazed they live to get to the hospital. But it doesn't last very long. Like the person who had been down long enough for their cat to start to get hungry. This is my ducking nightmare. I work at a gym and I never want to find someone dying/dead. It happens all the ducking time too. One of our nearby branches had 3 deaths in a month. One of which a guy just died sitting upright on one of the bikes. No one knew he was dead for hours. Whoa. I've never heard this before. Like they have heart attacks? Ducking, like and subscribe.